Hi, I'm Cara Buskmiller. I'm a maternal fetal medicine doc and fetal interventionist in Austin, Texas at Texas Children's Hospital, and it's Pregnancy and Infant Loss Awareness Month. I work with the Institute for Reproductive Grief Care on studies that help us do a better job as providers finding out whether there's inordinate amounts of suffering after one of these losses, because we don't have an easy way to screen for this. We have good ways to screen for substance use disorders, for perinatal depression and anxiety, for depression outside of pregnancy, but even though hundreds of thousands and millions of people experience reproductive loss every year in the US alone, we don't have a screener for picking up whether they're suffering out of what is considered ordinary. Another struggle is we don't even know what ordinary suffering is after some of these experiences. Some experiences are not followed by a lot of suffering, others are followed by deep, painful grief. And the moment of diagnosis or the moment of delivery or the moment of surgery or the moment of whatever is a flashpoint traumatic memory for people. And it's very difficult for us as healthcare providers and as a society to recognize that grief as real and talk about it without it becoming really a big challenge. One thing I would like to tell people about reproductive loss, which includes pregnancy loss, infant loss, as well as infertility, ectopic pregnancy, and other situations, is that you're not alone. If you had a miscarriage in an ER, there were probably 4 other people that day that had a similar experience. If you are experiencing a neonatal or perinatal death, there are over 2 million people that year that experienced something like that. So you are so far from alone, and you are so far from having no one who cares about what you went through. We care about what you went through. We want to find out ways to better care for you. So comment below if you have an experience that you want us to understand better, and support work like the Institutes and many other organizations that are paying attention to this grief that otherwise was so disenfranchised in previous decades and centuries. I'm excited for the future because I think people are, even though these are traumatic experiences, they are bearing fruit in how we understand the grief that people carry about their reproductive story and their family's story and their own story. So for Pregnancy and Infant Loss Awareness Month, I leave you with this, that the future is going to be different.